Even as several countries around the world embark on several phases of reopening amid a steady climb in the number of COVID-19 cases, the Pan American Health Organization, World Health Organization, country representative is adamant that the reopening of Guyana's airports should not be done in a haste. Dr. William Adu-krow, during an exclusive interview with Nightly News, pointed out that though airport services are essential, they pose a higher risk of more imported cases entering the country.
I think the airports have to be the last. The first to be opened usually. To open the community, we ask, is the activity really very necessary? And if the activity is really very necessary, you open. Because we are assuming that if we open the airport, we'll get only one imported case per day, and it's not likely. We are likely to get more than that. Plus, our points of entry that people just cross without papers. Our recommendation, and this has nothing to do with the government, if we were to recommend, we will recommend that the food establishments be the first to be opened, the public transportation as well, and even, all these things, we're saying that they should also have measures. So it's not like you open and then people do what they want.
After having assessed the response to the emergency measures imposed across the country since the COVID-19 outbreak, Dr. Adu-krow highlighted that the rate of transmission of the disease has declined.
How many cases everybody is likely to get? When I say everybody is likely to get, I mean how many cases that persons who are positive can infect others. And we started off from about 3.5. That if I get the infection, I will infect 3.5 other persons. Now it's falling to 1.4. That means that it's falling because of the measures that we have put in place.
Paho, WHO's new projection of COVID-19 cases in Guyana with continuous enforcement of the emergency measures is now 211 by June 20. However, Dr. Adu-krow cautioned that a complete reopening all at once could be devastating.
If things continue the way they are, by June 20th, we are looking at about 1,418 cases. However, if we maintain the level that we are presently maintaining, this could be as low as 211. But if we don't maintain those levels and some persons do what they want, then that could be the projection. Now, if we stopped everything, including airports, open everything, we are likely to have 10,777 cases by July 15.
Meanwhile, close to 3 months after the first case was confirmed, the local case count is 153, with a total of 12 deaths. Guyana is said to be among the top 5 Caribbean countries with the most COVID-19 cases. Temika Rodney reporting for the HGP Nightly News.